At first it sounds reasonable, better safe than sorry, right? But at some point you may start to wonder, do I really need all of this? That's a very fair question, because the truth is, after a certain age, not all tests are still beneficial. Some can actually lead to side effects, false diagnoses, or unnecessary medical interventions. This isn't a scare tactic. It's a reality that's gaining more recognition in the medical community, especially among doctors who work with older adults. They're beginning to acknowledge that a 75-year-old body shouldn't be treated like a 40-year-old one. So why are we still acting like it should be? In this video, I'll share with you 5 common tests that many older adults go through and why you might want to rethink them. Not because you're ignoring your health, but because good health doesn't always come from doing more, it comes from doing what's right. We'll talk about when a test that used to help may now pose a risk, how today's medical system sometimes puts procedures ahead of people, and most importantly, how to make informed decisions based on knowledge, not fear. If you're looking for a smarter, more proactive, and age-appropriate way to take care of your health, this video is for you. 1. Colonoscopy, still necessary after age 70. In the United States, colonoscopy is often considered one of the most effective ways to prevent colorectal cancer. For people between the ages of 45 and 65, this is well justified. Colonoscopies can detect precancerous polyps early and remove them before they become dangerous. But after age 70, especially in individuals with no symptoms or family history, the real question may not be, when should I get a colonoscopy? But rather, do I still need a colonoscopy at all? In reality, a colonoscopy is a more complex procedure than most people realize. It requires thoroughly cleansing the bowel with strong laxatives, fasting for several hours, and undergoing full sedation. What may be just an inconvenience at age 50 can become a real risk at 75. Dehydration, electrolyte imbalances, prolonged dizziness, and post-anesthesia confusion. All of these complications are more common in older adults, especially when their overall health has declined. According to a study published in JAMA Internal Medicine, nearly 1/3 of people over age 75 experience side effects or complications after a colonoscopy. But the risks aren't just from the procedure itself. What's rarely discussed is this. When a doctor finds a small polyp, it often triggers a cascade of follow-up tests and interventions. In many cases, these polyps are benign and grow extremely slowly, sometimes taking 10 to 15 years to become cancerous, if at all. If you're 75 or 80 years old and have had a normal colonoscopy before, the chance that any new polyps will cause problems in your remaining years is very low. Yet even a single abnormal result can set off a chain reaction. Repeat colonoscopies, biopsies, even partial colon removal, all of which carry real risks. Surgical complications, impaired digestion, and lengthy recovery times. Margaret, 79, from Oregon, is a telling example. She was still healthy, independent, living alone, driving herself and taking morning walks. Last year, during a routine checkup, her doctor recommended a regular colonoscopy. Margaret agreed, not because she had any symptoms, but because she figured it was better to be safe. But just the prep alone left her severely dehydrated, requiring hospitalization for IV fluids. After the colonoscopy, she was dizzy for 3 days and ended up falling in her bathroom and breaking her pelvis. The test results: nothing abnormal was found, but the aftermath lasted for months. Margaret lost the ability to care for herself and had to move into a rehab nursing facility for 6 weeks. That's when she began asking, was the test good for my health, or did it harm it? Margaret is far from alone. Many older adults undergo routine tests not because they have symptoms, but because the tests are recommended automatically, without being personalized. But modern medicine is shifting. The American Geriatric Society no longer recommends routine colonoscopies after age 75 unless there are clear warning signs. Instead, less invasive screening methods, like the fit stool test or Cologuard, are gaining favor for older adults because they offer a safer and reasonably effective alternative. If you don't have symptoms such as gastrointestinal bleeding, unexplained weight loss, or abnormal digestive changes, routine colonoscopy after age 70 should be carefully reconsidered. Asking questions isn't about rejecting medicine, it's about protecting yourself. It's not because you don't care about your health, but because you understand this. Real care is care that matches your age, your body, and your life goals. At this stage in life, you don't need to do everything to live longer. You need to do the right things to live healthier, clearer, and freer every single day. 2 full-body scans every year seem safe, but can become a burden. There's something very convincing about the idea of a full-body scan. You step into a machine, it takes just a few minutes, and it can supposedly detect any health issue in your body, from head to toe. Sounds like the perfect routine checkup, especially if you're older and want to play it safe. But what feels like caution, especially after age 70, can actually turn into an unwanted journey, a never-ending chase after things that may not even be illnesses, but still get you treated like a patient. The reality is that technologies like CT scans and MRIs are incredibly advanced. They can detect the tiniest details in your body. But that doesn't mean they're always helpful. When used on older adults without any specific symptoms, these scans often reveal what are called incidental findings. A tiny shadow in the lung, a small nodule in the kidney, a slightly unusual structure in the liver. These are often harmless, don't grow, and in many cases you could go your whole life without ever knowing they were there until you decide to scan. The problem isn't the detection, it's what happens afterward. Because even if the doctor says, it's small, probably benign, the image sticks in your head. Could it be cancer? And that's when the chase begins: follow-up visits, repeat scans, specialist referrals, biopsies, waiting for results, and sometimes even surgery, all triggered by something that, medically speaking, might never have caused any harm. Mr. James's story is a clear example. He's 76, still walks every morning, has stable blood pressure, and has never had any major health issues. At a local health fair, he was offered a discounted early detection full-body scan package. He agreed, thinking, what's the harm in getting checked just to be sure? The results showed a formed shadow on the upper right lung lobe. No symptoms, no coughing, no weight loss, no history of smoking. But just the words shadow on the lung kicked off a months-long chain of events. A consultation with a pulmonologist, a repeat CT scan, 3 months of monitoring, then a biopsy. During the biopsy, he suffered a minor pneumothorax and had to be hospitalized for 48 hours. In the end, the results showed benign fibrotic tissue that may have been sitting quietly in his lung for 20 years. But from that day on, he lost the peace of mind he once had. Every small cough or strange fatigue now brings that spot back to mind. This isn't a rare story. Older adults, when faced with too much information about what might be wrong, can easily get pulled into a cycle of anxiety and unnecessary medical interventions. In medicine, this is called overdiagnosis, when you find out too early about things you didn't need to know and end up treating them not because it's necessary, but because you can't help but do something. For younger people, that might be acceptable, but for older adults, the consequences are very different. The body doesn't bounce back like it used to. A simple biopsy can turn into a week in the hospital. Lying still in an MRI machine for 40 minutes can cause back pain, joint stiffness, or trouble breathing due to spinal degeneration. And on top of that, many of these scans aren't covered by insurance because they fall outside standard screening guidelines from the American Medical Association. Seniors often have to pay out of pocket, not just for the scan itself, but for the entire long follow-up process that comes after. That doesn't mean you should ignore your health. It means you should be selective, act on what's truly necessary. If you have symptoms like persistent pain, coughing up blood, or unexplained weight loss, then yes, get imaging. But if you're completely healthy with no symptoms and someone suggests a full-body scan just to be safe, stop and ask, will this information help me live better, or just make me start living like a patient? Because real health at this age isn't just about test results. It's about the quality of your daily life. Are you sleeping well? Moving around comfortably? Enjoying your meals? Still happy walking your grandkids around the block? Those are the indicators that won't show up on a scan, but they're the ones worth protecting. 3 cardiac stress tests. Beware of unnecessary treadmill runs after 70. If you've ever had a general checkup or seen a cardiologist, you've probably heard of something called a cardiac stress test. Basically, it's a test designed to check how well your heart works when it's under pressure. There are 2 main ways this test is done. The most common method: you'll be asked to walk or lightly jog on a treadmill while your doctor monitors your heart rate, blood pressure, and ECG, electrocardiogram. The goal is to see if your heart is pumping enough blood when it's working harder. If you can't exercise, the doctor will inject medication that makes your heart beat faster or contract more forcefully, mimicking physical exertion, and then observe your heart's response using imaging tools like an echocardiogram or cardiac CT. It sounds logical in theory. Push your heart like it's climbing a hill or running, and if there's a blockage in your coronary arteries, it'll show up. But here's the problem. If you're over 70 and don't have any symptoms, this test is more likely to do harm than good. Why? Because aging naturally changes your body. Arteries stiffen, the heartbeat shifts slightly, and blood pressure becomes more erratic. These changes aren't diseases, but the test can't tell the difference. It just sees something abnormal, and suddenly you're labeled as having heart issues even though you're perfectly fine. The result: you might get sent for more complex tests, like a coronary angiogram, cardiac catheterization, or even a stent or surgery, all because of a false positive. And for older adults, these procedures carry real risks: bleeding, kidney problems from contrast dye, sudden drops in blood pressure, or long recovery from post-op complications. Mr. George is a classic example. At 74, he was in good health. No chest pain, no shortness of breath, still playing ping pong with friends. At a routine checkup, the doctor suggested a stress test just to be safe. The results were inconclusive. He was referred to cardiology. 3 weeks later, he was on the operating table getting an angioplasty for a suspected blockage, something that had never caused a single symptom. A few days later, he developed an infection at the catheter site, ended up in the ICU, spent 5 months recovering, and was left frail and unable to return to his usual routine. This isn't rare. That's why the American Heart Association, AHA, and the American Geriatric Society, AGS, now advise against routine stress testing in older adults who have no symptoms. If you're not feeling anything unusual, no chest pain, no shortness of breath, no unusual fatigue when walking, the test offers no clear benefit while the risks are very real. Heart health after 70 shouldn't start with machines. It starts with daily movement, a healthy diet, good sleep, positive relationships, and stress management. Simple but solid habits. These do more for your heart than any wired-up test with flashing screens ever could. This stage of life isn't about chasing down every possible risk. It's about living deliberately, clearly, and with purpose. Saying no to an unnecessary test isn't neglect, it's protecting your quality of life. If you found this section helpful, leave a comment with the number 3. And if you haven't subscribed to the channel yet, hit follow and turn on notifications, so you don't miss any videos that help you stay healthy, proactive, and true to your values after 70. 4. PSA testing. Beware the cost of prevention after age 70. Many men over the age of 70 still get a PSA test every year, treating it like part of their regular checkup routine, similar to checking blood pressure or blood sugar. PSA is a biomarker found in the blood, short for prostate-specific antigen. Elevated PSA levels can be an early sign of prostate cancer. That might sound reasonable. Detect it early, treat it early, prevent cancer right. But the reality is far more complicated, and in many cases, more troubling than reassuring. Prostate cancer is fairly common in older men, but most tumors grow so slowly that patients often die of old age or other causes long before the cancer ever causes any symptoms. In other words, early detection doesn't necessarily mean it will become a problem. Yet a PSA test often opens a door that can't be closed. A slightly elevated reading leads to more tests, then a biopsy, then an MRI, then surgery or radiation, even when that tumor might never have caused harm in the person's remaining lifetime. And what no one spells out clearly is this: these interventions, especially after 70, are far from simple. The patient may end up facing erectile dysfunction, urinary incontinence, lingering infections, loss of confidence, or post-treatment depression, all starting from a blood test that may not have been necessary in the first place. Walter, 76, is one such case. Still healthy, drives every day, no unusual symptoms. During a routine checkup, his doctor suggested a PSA test just to be safe. The result came back slightly high, and though he had no symptoms, he was referred to a urologist. A biopsy revealed low-grade prostate cancer, not dangerous, but just hearing the word cancer was enough to alarm his whole family. Walter agreed to have surgery to take care of it in advance. The result? He lost control of his bladder for months, stopped going out, and gave up sports. His sense of freedom and energy declined sharply. The sad part is, had he never taken the PSA test, he likely would have continued living well and maybe even better. And Walter's case isn't unique. Today, major U.S. medical organizations, including the U.S. Preventive Services Task Force USPST, do not recommend routine PSA screening for men over 70 who have no symptoms. The reason is clear. It doesn't significantly lower mortality, while triggering many unnecessary interventions and leading to physical, emotional, and financial harm. In other words, the benefit isn't worth the risk. Instead, what matters most is listening to your body. If you're not having trouble urinating, not feeling pressure in your lower abdomen, and not waking up multiple times a night to pee, then it's perfectly reasonable to skip the test and monitor actual symptoms instead. Choosing not to take a test isn't neglecting your health, it's protecting your quality of life. After age 70, the goal is no longer just extending life at all costs, but preserving independence, clarity, and a sense of control over your body. Every test comes at a price, not just financial but also peace of mind. And early detection doesn't always lead to better outcomes. Sometimes, knowing less and living more carefully is the smarter path. If you found this section helpful, leave a comment with the number 4 below. And if you haven't subscribed yet, don't forget to hit the subscribe button and turn on notifications, because upcoming videos will help you make smart, timely, and truly beneficial choices for life after 70. 5. Early Alzheimer's screening when fear makes us act too fast. No one wants to lose their memory. After age 70, forgetting a name, misplacing your keys, or repeating a story can be enough to trigger real worry. Am I starting to lose it? And out of that fear, many people turn to memory tests for reassurance. From simple exams at a clinic to more advanced options like PET scans, brain MRIs, or genetic tests, all are advertised as ways to detect Alzheimer's early. It sounds proactive and smart, but sometimes, knowing too early ends up disrupting life in ways that aren't necessary. Ellen's story is a perfect example. She's a 75-year-old woman in Oregon who still walks every morning, does crossword puzzles, reads novels, and handles her family's finances. But one day, she forgot her email password. That made her daughter worried enough to take her for a memory checkup. The test came back with mild cognitive impairment, a vague term, but scary enough to plant seeds of doubt. After that, Ellen started questioning herself. If she hesitated mid-sentence, she feared others would notice. If she read more slowly, she worried her brain was declining. From being confident and lively, she began to avoid gatherings, spoke less, and eventually felt like she had become a patient, even though nothing serious had actually happened. That's exactly what more and more geriatric doctors are warning about. Routine memory screening in people with no clear symptoms, meaning they're not getting lost, not forgetting loved ones, not struggling with daily tasks, doesn't improve outcomes. But it does increase the risk of an early diagnosis without any effective treatments. And just having that label, early signs of Alzheimer's, can trigger a domino effect. Anxiety, depression, social withdrawal, and even retreat from life, all while the memory may not actually be deteriorating at all. What most people don't realize is, the brain ages in its own way. Some forgetfulness is perfectly normal. Taking a moment to recall someone's name doesn't mean your mind is failing. But because society has made Alzheimer's into such a terrifying image, just hearing the word can send us running for a test, just to be sure. Unfortunately, science doesn't yet have a cure, and early detection in people with no symptoms rarely leads to any real change in treatment. The real question isn't, do I have Alzheimer's? It's, am I actually having trouble with daily life? If you're still managing your money, still know where you are, still staying connected with friends, still reading, thinking, responding, then you're probably just experiencing the perfectly normal process of aging. After 70, what you need isn't routine brain scans like you're checking your car battery. What you need is good sleep, mental challenges every day, regular social interaction, and a life that still feels full, not one spent waiting for a diagnosis. Not getting tested doesn't mean you're ignoring your health. It means you're choosing the right time, the right reason, and the right goal. If this made you rethink what you should, or shouldn't, be screening for after 70, leave a comment with the number 5 below. And if you haven't subscribed to the channel yet, don't forget to hit follow and turn on the bell. The next video will give you more insights to help you not just live longer, but live well, in the way you choose. After age 70, taking care of your health is no longer about getting as many tests as possible. It's time to pause and ask directly, is this actually helping me stay healthy, or is it just making me more anxious? No one denies the value of tests and screenings, but it's important to understand that every test comes with a cost, psychological, physical, and financial. And sometimes, knowing when to say no is the smartest medical decision you can make. You don't need to be a doctor, but you absolutely can and should be the one making decisions for your own body. If your goal is to stay healthy, without being overtreated or caught up in the complexity of the medical system, start today. Ask questions before agreeing to any test. Learn the pros and cons, especially if you don't have symptoms. Share this video with loved ones in their 60s or 70s. They might need to hear this before it's too late. Leave a comment below if you've ever had an unnecessary test. Your story could help someone else stay alert. And if you think this message is worth spreading, hit subscribe and turn on the bell. Because here, we don't just talk about illness. We talk about living healthy, living with intention, and living true to your values. Thank you for watching until the end. Remember, good health doesn't just come from medicine. It comes from wise and courageous choices made every single day.